we're all volunteer organization that started in 2011. We work with seniors in the community to help them stay in their homes so that they don't have to go into assisted living or, earlier than they need to. I mean, some people will end up transitioning into assisted living anyway, but we help in a lot of different ways. We help people with yard work. We help them with getting them to the doctors when they've stopped driving. We put on social programs. We also provide information and referral to other services. We do educational programs like a fall prevention program or a estate planning where we bring lawyers in to help them do their wills and their essential documents. During COVID, we decided that it was not safe for us to go into people's homes or to help them, or to drive them to doctors. And so we've now initiated some new things, one of which is contracting with a transportation service, which allows people that don't use smartphones, but just have a telephone, to arrange to get transportation by calling a number, and that service then arranges for Lyft or Uber or a ride service to get them to the doctor. We're covering those costs as a result of this a very generous foundation grant from the Greater Washington Community Foundation. We're also delivering groceries, no contact, social distanced groceries, which we bring to their porches. We'll pick up a credit card of, a list and go to the grocery store for seniors and bring the food back or the supplies back or the prescription back. And we also have started an emergency fund, which allows us to give financial assistance to people who they or their family members may be out of work and just really struggling. It's right now it's $100 debit cards. We can provide more than that if there are more people in the household. And we're looking at other things. We'll probably buy some food for the food pantries near us, to make sure that they have enough food to be able to provide people. So we're trying to adapt and do as much as we can, and we're providing check-in calls, so spending time talking to people.
Can you tell me why it is so important for you to help seniors right now?
Well, I think given how frightening it is that this is the age group that is most at risk, I think it's terribly frightening, especially if people have an underlying condition of some kind. Like one of our neighbors who's been with us for a period of time has COPD, and that's already affecting her lungs. If she were to get COVID, it would be really dangerous for her, and the death rate is so much higher. And mostly, many of the people are women living by themselves, and they are, it's just a very lonely and isolating existence. And so, this makes it more so because we can't go to their homes, we can't come in the house with them, we can't take them out to any place. So, I think that's one of the reasons. Seniors often live on limited financial assistance also, and they still need to keep up on their bills. That their money will continue, but it may well be that they have family members who also need help, who may not be in the area but need help because they've lost their jobs. We know here, obviously, in the county, the numbers of COVID-19 cases is higher than almost anywhere other than up in the state. I mean, Montgomery County has slightly more, but it's very prevalent here, and it's dangerous here. People are essential workers, and they are getting the disease and they are suffering. And that's a worrisome thing, I think, too, because there's more COVID-19 around that would affect seniors if they were to go out.
Can you tell me more about the personal check-ins?
Sure. We've always had a phone tree where we let people know about events that are going on, and we also just call when there's something. It started when we had weather events here in the city, so around snow or around really heat waves. It started several years that way. And what we've done now is to bring more people in to make the phone calls so we can make the phone calls more often. So we try to check in once a week with everybody that we're serving. And, you know, they're friendly calls. People get used to being able to have a conversation. They, you know, get to know each other over the phone. They get to know their history and their background. So it becomes a friendly, you know, a friendly chat. And we then check in. How are you feeling? You know, are you okay? How's your family? You know, what you would do with, you know, with any friend when, you know, when you're checking in on them.